Excellent. Well, welcome to the third annual Abarca Forward conference. My name is Arundhati Parmar. I'm the editor-in-chief of MedCity News, which is an industry publication that has been covering innovation in healthcare since 2009. Now, as you know, Abarca Forward is an invite-only conference, which could only mean one of two things. You are either very important to the future of healthcare, at least as far as the Abarca folks imagine it, or, as it is in my case, entirely dispensable to your employer, except for maybe 1 or 2 days. In all seriousness, though, Abarca Forward is centered around fostering meaningful engagement. The goal has been to bring together a select group of industry leaders, you guys, to create a constructive discussion and collaboration platform, especially as it relates to the PBM and pharmacy models. Today, we will discuss the future of pharmacy, drug pricing, and cost management, and then juxtapose it with how we leverage technology in the pursuit of the promised land. Am I speaking too loud? I hear a lot of chick. Maybe it's my hair. Fair enough. So today we will discuss the future of pharmacy, drug pricing, and cost management, and then juxtapose it with how we leverage technology in the pursuit of the promised land. That is the frictionless and personalized healthcare system. That conversation will be spearheaded by John Bardo, Chief Digital Transformation Officer for U.S. Health and Life Sciences at Microsoft, and Bertel Chapuis, co-founder of Extillion. Okay, we'll use this. Co-founder and CEO of Extillion. Now, I attended Abarca Forward last year for the very first time, and I participated in a media panel, and I also got a chance to interview Abarca's CEO, Jason Borschow. I was struck by how open and transparent everyone was. That same spirit, I hope, will pervade in today's conference. Like last year, we have a reporter from MedCity News covering the conference. If you absolutely do not want to be quoted, although I really hope you do, please find me in the audience or my colleague Marissa Plesha, and then she will make sure that you're not quoted. So last year, what really struck me was that the CEO of the Industry Association, PCMA, was also in attendance. That told me, he not only attended, he also spoke. That told me that even as the industry lobby is fighting scrutiny in Congress, and as he tries to defend his largest members, you know, the CVS's, Cignas, and Optums of the world, he possibly could see that the future of the PBM model and the PBM industry was going to be very different. He could possibly also tell that slowly, very slowly, payers would begin to extricate themselves from working with just one legacy PBM. And in a sense, that was what precisely happened. In August of 2023, the nonprofit Blue Shield of California completely restructured how it pays for drugs and revamped its PBM relationship. Instead of working solely with CVS Caremark, it announced that, yes, we'll work with CVS Caremark, but we'll also work with 4 other companies. And they were Abarca, obviously, Amazon Pharmacy, Cost Plus Drugs, Mark Cuban's company, of course, and Prime Therapeutics. CVS Caremark would, from then on, just be handling the specialty piece. So a gradual shift is occurring in how payers want to pay for prescription drugs. And in the agenda today, you will be able to see the way forward as experts discuss the pharmacy model and reimbursements. Now, last year, the conference addressed value-based contracting as it relates to expensive cell and gene therapies and what payers need to make those value-based contracting agreements viable. Little did we know then that GLP-1s would explode into the mainstream consciousness, and payers and employers would have to deal with paying for these highly effective but very costly drugs. Again, today you'll hear from experts discuss on how to pay for these medicines without breaking the bank. The way forward, however, is about much more than the affordability of drugs and reinventing the pharmacy model. We all need to be talking about the 800-pound gorilla in the room, and that is artificial intelligence. The potential and peril of leveraging AI in healthcare is not to be underestimated. We are on the cusp of a new industrial revolution, and AI will impact everything we do. It will be disruptive, but hopefully one where the positives outweigh the negatives. We have all known about AI in medical imaging and in radiology, but generative AI has fully captured the public imagination. So I actually have a couple of questions for the audience, and I'm going to ask for a show of hands. How many of you have used ChatGPT for work? Okay, still a minority, but not a small minority. And how many queries do you think ChatGPT handles in a single day? I'll give you 3 choices. 100,000, 500,000, 1 million. So let's see a show of hands for 100,000. No one, smart audience. 500,000. Still no one. 1 million. Well, I fooled you because the real answer is 10 million. It handles 10 million queries in a single day. So now generative AI is also making its way through healthcare. Epic is integrating GPT-4 into its electronic medical record. And a few months ago, I saw an application of Microsoft's AI capabilities that I thought was very meaningful from a patient perspective. So all of us have undergone blood work and medical imaging, I imagine, some point in our lives. And I don't know about you, but when I go read all those reports in my EHR, I had to feel that, I basically felt that I can't understand what this means. So I have to Google those pesky medical terminology to figure out what the heck is happening in my body. But what Microsoft demoed late last year was this AI capability that would enhance the medical reports in plain English. So if there was a term that was just crazy and you didn't know what it meant, you wouldn't have to go to Google to figure out what it meant. There was a little sidebar that explained what those terms were. Of course, they were smart enough, so they added all the necessary AI disclaimers. But what a wonderful idea where you can see healthcare becoming truly personalized. So to help us in that journey toward personalization, you have to be willing to imagine things anew. And that is what people tell me Abarca is doing in the PBM marketplace. A few months ago, MedCity News held an intimate networking event with the CEO of Blue Shield of California, and Paul Markovich explained very succinctly why his nonprofit decided to select Abarca as it sought to revamp its PBM relationship. He said, and I quote, "We had to find a pharmaceutical claim system that could actually process claims without rebates, which is a lot harder than it sounds because the whole system is based on these rebates and fees. Turns out Abarca has really designed a system to do that." Now, who imagines that such a system was possible? Our next speaker and your host, Abarca's CEO, Jason Borschow. Jason has been instrumental in guiding Abarca Health, fostering transformative initiatives to improve patient care and pharmacy services. Please join me in welcoming Jason to the stage.
Good morning. Thank you, Arundhati. Thank you. How is everybody? Good morning. When people say good morning to you, you clap? I want to hear some good mornings, like some really energetic good mornings. So welcome to Abarca Forward 2024. As Arundhati said, our 3rd annual Abarca Forward. And I have to tell you, the first 2 were great, but I have no doubt in my mind this will be the best forward yet. How many of you have participated in Abarca Forward before? Raise your hand. So mostly the people on this side, which is interesting. So about half the room, right? And we're very intentional about what Abarca Forward is. We wanted to find a better way, have a different approach in terms of how we connect and collaborate. Abarca Forward is meant to be an intimate event where we're able to have deeper conversations than you would normally have at a conference, right? We're not here to talk at you. We're not here to tout the programs that we've built and the products, right? The first rule of Abarca Forward is we really don't talk about Abarca, right? And that's a huge change from the way that organizations think about connecting with their business partners, with their clients, and with their prospects. Because at the end of the day, the problems that we're solving for are not about us. They're about patients, and they're about the future of our country. And so let me reintroduce you, with your permission, to what Abarca Forward is all about. Since our first forward, where we put out that vision for healthcare 2030, everybody remember? There's been quite a bit of progress. Folks are prone to say, and I don't remember who the original quote is, but I've heard Bill Gates give the quote many times, is that people overestimate what they can achieve in a year, and they underestimate what they can achieve in a decade. And in just 2 short years, many of the predictions that we put forward in the first Abarca Forward for the future of healthcare in 2030 have actually advanced quite a bit more than I would have imagined, right? We declared that by 2030, transparency would no longer be discussed in PBM. It wouldn't be discussed because it would become the norm, and the exception to transparency would no longer exist. I believe that's going to happen a lot earlier than 2030, right? I believe it will happen probably in the next 2 to 3 years, well in advance of 2030. Another prediction that we made was that AI was going to change the way that healthcare was delivered in a seamless and personalized way. We declared that by 2030, all prior authorizations would be automatic, right? And nobody would have to navigate a manual prior authorization process because you would be delivered a personalized formulary based on your needs, not a one-size-fits-all approach that you have to navigate with exceptions, et cetera. With the advent of generative AI, the explosion of ChatGPT, OpenAI, and all of the other large language models, I believe that will happen well in advance of 2030 as well, right? 2 years ago, it sounded a little bit crazy. And today, one would think that it's not just crazy, but we're going to make it happen. Are there challenges? Of course. This is healthcare after all. Right? The hardest industry in America. Just ask the tech companies that have entered this industry. It takes them a long time and most have failed. So there's a lot of signs of progress. We also talked about the concept of virtual vertical integration. One of the trends that we've seen over the last 10 years is increasing consolidation in the healthcare space, where payers are acquiring providers, are acquiring PBMs and processors, and creating a exclusive lock on the market. And they're doing it with the guise of giving an integrated experience, but all of us who have navigated that, all of you, health plans, payers, employers, consultants, things haven't gotten better from a quality and connection perspective. However, the margins of the vertically integrated entities have gotten much better, right? So vertical integration is really good for having folks move the margin to the place where it's least scrutinized and where it can be maximized. Am I saying something that you've experienced? And so we put forward this idea of virtual vertical integration, which is the concept of using a technology platform to transform the system by connecting folks who don't all own every piece of the service and supply chain. And our now partners in Blue Shield in California made a huge, bold step last year of declaring a new future. They call it virtual pharmacy benefit administration, but it's the same concept, right? It's that deconstruction of a system that forces folks to make decisions that may not be in their best interests and where incentives are misaligned. And so we expected that change to take a longer time because we've been talking about this for 15, almost 20 years, but this progress isn't linear. And it takes somebody bold, somebody brave, like Paul Markovich and Sandy Clark and Allison Lum to buck the status quo. And we're proud to be part of that and to make that revolution happen. And so many of you already know about Abarca. We're not that company in Puerto Rico that you've never heard of before. Right? We've kind of gotten past that, at least for most, and we appreciate that. But I want to tell you a little bit about Abarca for those of you who are new to Abarca, and I want to start with our purpose. We actually are idealistic and maybe naive enough to believe that our purpose is achievable and possible. It's not just something that we put on the wall, it's something that we talk about every day and integrate into every facet of how we make our business decisions, interact with our customers, design our products, hire and fire our people. But in essence, we believe there is a better way, and a better way to do some specific things. Number one, to work together. Number two, to connect with each other. And Abarca Forward is because we believe that this is a better way of working together and connecting with each other. And most importantly, to make healthcare seamless and personalized for everyone. And when we say seamless, we mean convenient and affordable. And when we say personalized, we just mean tailored to our unique wants and needs. There's many parts of the economy that are very advanced in terms of their personalization. We have folks here today with incredible experience there. We have our partners from GoodRx. Scott Paul is here. You'll be hearing from him later. We have our industry innovators from Waltz Health. We have John Lavin from Amazon Pharmacy. John, you can raise your hand. I think you're back there. We really have lots of different folks who have different experiences on the consumer side of healthcare. We have Mara Mitchell from Oscar. Oscar's been a real innovator in changing the consumer experience of health insurance. And so we do believe it's possible. And from where we're coming from, it's really nothing short of a revolution that's needed in the system. And that revolution doesn't happen from one company. It doesn't happen from one person. It happens when a critical mass of like-minded thinkers interact and collaborate in a different way than they could have ever collaborated before. And so the goal of Abarca Forward is to promote, is to enable, is to supercharge those connections and interactions. And so what we want from you here today, like the goal of today, your mission today, is to do three things. The first thing is to change your perspective on something that you came here thinking about in a radical way, right? To learn something and or to help someone learn something that they just didn't see when they walked in here today. If you could do one thing, that would be worth it. The second thing we'd like you to do today is to develop 3 relationships that you didn't have before Abarca Forward, relationships that will be meaningful in moving the ball forward to seamless and personalized healthcare. We invite you under the banyan tree because it's pretty, but really it's because we want you to build relationships with people that you don't know. And so by the time that we're done tonight at dinner, it's 3 new relationships that are meaningful, right? And so those of you who are ahead of the game, great. Those of you who are still at 0, start thinking about it. And the third thing we want you to do is to have fun. It's not an accident that we invite you to Puerto Rico, where it's beautiful and the hotel is very nice and our team does a fantastic job setting up Abarca Forward. Can we have a round of applause for our team? It's not because we want to entertain you. It's not because we want to wine you and dine you. It's because human creativity is at its best when you're relaxed, when you're comfortable, when you're not stressed, right? And that's why we've brought you together and created this experience. So Abarca Forward is highly curated, but not choreographed. It's very intentional who's invited and how we're structured, but it's not scripted, okay? And so our expectation is that each and every one of you participates vigorously today. Sure, we learn a lot more from listening than we do talking. And so I'm not asking you to talk all the time. And there's a microphone in there. I think Arundhati may be passing microphones around, during the course of the day. This is not the kind of event where the people on stage talk to you and you just listen. The people in the audience here are just as capable, just as qualified, just as knowledgeable as the people on the stage on many of these topics. And so our expectation is that these discussions become healthy and frothy all the way from when we start off, in about 15 or 20 minutes to when we're done in the day and we have our closing. You're expected to participate. And there are about 40 people who attended last year who aren't here this year. There are many reasons for that. But one of them is we always say, if you want to be invited to Abarca Forward in the future, you must participate actively. And so think about how you're going to contribute, right, in addition to how you're going to learn, but you're not here on accident. So in any other industry, the things that we're talking about here wouldn't sound like a revolution. But in our industry, it is a revolution. And we think that prescriptions are that front line. It's the place to start. It's the most transactional, it's the most well understood, it's the most commercially viable piece to make the changes. And so that's why we built this company, because we think we can spark a broader healthcare revolution from transformation in the prescription ecosystem. And to quote my friend Jeff Park from Wealth Health, in healthcare, evolution is revolution. These are people's lives that are at stake. Everyone wants to talk about disrupt. Who wants to have their healthcare disrupted? It's disruptive enough to navigate the system as it is. So the people in this room are the thinkers, the leaders, and the doers who've actually dealt with the real problems in the industry, not just talking about or aspiring or wondering. The people here are responsible for millions and tens of millions of Americans in terms of their healthcare. And their decisions, or your decisions, are not in theory, they're not theoretical. The decisions you make about who you partner with, about how you operate, when you innovate, how you work with government, how you adapt to regulation, those affect people's lives. And it's not one change or one decision. The transformation, the revolution that we seek is the result of hundreds or thousands of decisions that are iterating over time. Okay? And so we hope to move that ball forward, pun intended, significantly today. I can't leave without talking a little bit about AI and artificial intelligence. One thing about Abarca, and one thing I think that distinguishes me, is I'm really not into buzzwords and hype. And so when people start overhyping something and talking about it all the time and giving buzzwords, at one point it was big data, and then it was machine learning, right? And then it was crypto, blockchain transactions, right? And now, we have AI. We wanted to have a conversation about AI that was different from the conversations that everyone else is having about AI. And that's why we designed this morning around demystifying AI to make healthcare seamless and personalized. Why demystify? When you play with AI, it feels kind of magical sometimes, right? You ask these questions, you interact, and you're like, how did it know that? How did it do that, right? It captivates us in a magical way. AI is magical, but it's not magic. It's actually, a very particular way of interacting with computers that's been developing over a long period of time and has had some real breakthroughs in the last couple of years from like a hardware infrastructure perspective and from a software and models investment and people perspective. And so the possibilities for AI to change healthcare and the world are limitless. Okay, I believe that the innovations in AI, the inflection point that we're at, it's nothing short of it's equivalent or greater than the creation of the internet, like at that scale. And if not well understood, if you don't choose the right partners and you don't think about this in the proper way, I believe that we can waste hundreds of millions of dollars and lots of time, right, chasing that bright, shiny object without really understanding where the opportunities are to create value, to make healthcare more seamless and personalized. So you're going to hear from John Bartow from Microsoft, from Bertil Chapuis from Extillion. You're going to dive into co-creation sessions in the room down the way to really get deep, and you're going to get a little uncomfortable, I think. One of our values at Abarca is called off-road, which is expand your comfort zone and explore bold new paths every day. We're going to go off-road, and you're going to see some pretty crazy stuff that Microsoft and Extillion have built over the last couple of weeks to help demystify AI. When we say demystify, it's not to take the magic out of AI. It's to increase the understanding and the literacy of the key decision makers in AI so we can make informed decisions, so we can make informed investments, and so that business folks can work with technology folks, that companies can work with technology partners in a different way to move this ball forward much more quickly and expeditiously. So it's a risk, but nothing great ever happened without taking risks, and I hope that when we're chatting about this over lunch, the risk will be worth the reward will be worth the risk. So I want to, in the afternoon, we'll be talking about the transformation of the PBM model. And you literally have a star-studded lineup of thinkers, leaders, and doers who are addressing the most challenging parts of the PBM model, from how do we think about pharmacists and their role? You know, the pharmacy industry is in the most, I think, challenging economic position it's ever been in history. It's something that I think PBMs and payers have caused and created. And I think that pharmacies in some cases have done it to themselves, right? I think that they've in many ways commoditized their business and you know, I'm not gonna name names, but it's come to a breaking point. Right? And even the largest chains of pharmacies, they're either going bankrupt or changing their business models fundamentally. And I think we really need to think about what is that role of that pharmacist, that healthcare provider, and how do we compensate pharmacy in a different way that's based on ROI? You know, it sounds really great to pay pharmacists based on their cognitive services and the counseling that they do for patients. But for the people paying the bills, that doesn't sound like accountability. That doesn't sound like ROI, okay? That sounds like compensating people for their efforts and their education. And that's not how market economies work. People are compensated for the results. They're compensated for the outcomes, Brent, pun intended, right? So you're gonna hear some really healthy conversations, and I'm expecting the payers in the room to really challenge those providers around some of the things that they're saying. And there's a reason why Jim Gartner, our partner from PerformRx, is moderating that panel. He's one of the few payer leaders who really gets the other side of the equation. Okay? Javier and his stellar team from all different walks of the industry, doctors, employers, payers, technology providers, are going to talk about the other 800-pound elephant in the room, GLP-1s. Those 3 letters in that number, I'm sure, you know, 6 months ago, very few people outside of this room understood what they meant. And now people are experts and they know all the brands and, you know, where they can get them and where they can get them compounded and where they can buy them. I mean, this is the most impactful, you know, innovation in drugs, I think, I would say probably since the advent of insulin, but at least statins, maybe from statins when they came out originally. There's great promise. And, you know, I ask people, if Mounjaro and, you know, Zepbound and all these other brands from Lilly and from Novo and all these companies, if they, like, at what price would this not be dramatic? At what cost would the value be there? Is this just a pricing challenge, or are there some philosophical, social, other challenges around thinking about the role of medicines and medicine in terms of people's life and their lifestyle? So you're going to have some really healthy discussions. These are problems that all employers in this room, all payers in this room are struggling with. And I think that the big question mark is, well, what's going to be the role of government, state and federal government, you know, in mandating and changing the way that we think about the social contract that we have? And frankly, this goes to the fundamental definition of what is a PBM. For a long time, weight loss was considered this cosmetic thing that sits outside of the healthcare industry. Maybe you could have a rider, or maybe you could have some buy-up or something like that, but excluded from Medicare, mostly excluded from Medicaid. And, you know, a lot of employers say, hey, this is cosmetic, you know, your weight is your problem. And we can't deny that the way that society has evolved, the comorbidities that are associated with weight are bankrupting our healthcare system. right? And we now have drugs that are starting to show promise in ways that they had never shown before. There's going to be a healthy discussion there. And finally, we'll close out the day with a panel led by Allison Lum, our partner from Blue Shield. And let me say something about Allison. I met Allison last year when we flew out to San Francisco for the finalist presentation. And I've been working in managed care for almost 20 years. And I've met some great managed care leaders, but I don't think that I've met a managed care leader that cares more about patients and families than Allison Lum. And so she's here to talk about transparency and consumerism, but she's coming from a place of a healthcare system that's worthy of our loved ones, that's worthy of our family. And sometimes we forget that in terms of making healthcare seamless and personalized. So I'm super excited about that panel. You know, I get tired of talking about transparency and consumerism and confusing the two, but hopefully in that panel we'll be able to tease out some of those differences, and maybe afterwards we can connect some of those dots. And so the PBM model is under transformation right now, not to say under assault. There's FTC investigations. I think even my kids finally know what a PBM is because, you know, they say, Dad, are you those evil people, you know, that steal money and don't let people get their drugs? Right? I don't think that anybody, except maybe some of the people in this room, see the value that PBMs creates. And I think that it's been mostly brought upon, the industry has brought it upon itself. And look, a lot of folks talk a lot these days about, well, we want to change the acronym. We want to be a pharmacy benefit partner. We want to be a pharmacy benefit this, a pharmacy care manager, a pharmacy services that. And I hear this from my people and I hear this from our competitors, you know, in the industry. And I say, guys, it's not about the acronym. It's not about the name. It's about what you stand for and how society understands the value you create. And so PBM is here for the long run. It's just not going to be understood and called PBM in the same way. And we're going to have to decide if we want the government to drive the future of how pharmacy services are delivered, or we in industry want to change that proactively. And so you have some real thinkers and movers in this room, technology providers. We have Omar Afridi, co-founder of TruePill, who just launched Foundation Health here. We have Otto Sipe next to Omar from Photon Health. You probably never met them before or heard of them before, but they have some really bold ideas. I encourage you to talk to them, and I encourage them to participate, you know, in the panels today. And we have folks from all walks of life. We have Abarcans here. We invited 3 Abarcans who applied to participate in Abarca Forward, Kelvin and Maria and Howard, because of their outstanding performance last year. And their incredible applications, they were invited here. So thank you guys for coming, and you're gonna really, everyone give them a round of applause. So I would like to close with quoting our partner, Paul Markovich, CEO of Blue Shield of California, about the future of PBM. And it's really that evolution is revolution, that, you know, disruption is really transformation. PBMs may cease to exist as we know them, but as Paul says, I expect, and I think he shared this in an interview with Arundhati, I expect once we've been successful with it, it's going to become the norm, or something along these lines is going to become the norm. The whole world is going to have to shift. Now, I'm not saying pharmacy benefit managers are going to go away, but they're going to have to change their model, as will everybody. It's not just them, it's everybody in the middle who's going to have to change their model. Abarca built our company to find a better way. We believe that together, we can be the leaders and change this model with humility, with innovation, with iteration, and with technology, and we want to move that ball forward today. And so I'll throw out some questions. I have 4 minutes and 23 seconds. I'll throw out some questions that I want you to start thinking about that we'll come back to at the end of the day. What is holding me or my organization back from leveraging AI more meaningfully to better operate our business, to deliver a more seamless and personalized experience to members and providers? Anyone care to jump in on that? sounded good when I said it before, but now when you actually have to get up, it's a little more, it's a little harder. Come on, Mara. What's holding me back? Do we have that microphone on, guys? We need it on. Guys in the back, do we have that microphone on? Please? Maybe we got to push the button, on button. That'll do it. All right.
All right. So I think what holds people back from AI is fear. Oscar has long since innovated. We've used AI in our technology from day one. I mean, Mario is very forward thinking. But as people come into our organization, especially those who come from a more traditional healthcare background like myself, a lot of times it's fear. It's fear that I'm going to take the personalization out of it, when in fact what you're actually doing is finding ways to iterate faster, service your members faster, and add personalization where it matters most. But I would, fear is the thing that holds most people back from leveraging it. Now we also have to deal with regulation. So that's the other part now that's coming about. It's not just fear that's about something new and unfounded. But now I think what we're starting to see is a little bit of hesitation from people of what's the regulatory landscape going to be around this? And how do I make sure that I'm developing and using AI in a way that as that regulation comes forward, I'm still able to operate and iterate and do the things that I want to do.
Mara, thank you. You will be invited back next year for certain. Round of applause for Mara. So, for years, payers and providers have sought to deliver an Amazon or Apple-like experience for consumers. How many times have you heard about this, in your business? But progress has been somewhat slow. I think we're getting unstuck here in the last few years. Well, what's really holding us back? What's getting in the way of providing that seamless and personalized consumer experience? And do we think that by working together, or how can the industry accelerate change and really become consumer focused? Any thoughts on this one? All right, Susan Westcott from Mayo.
We have a good row. I think part of it is making accessible the indoor to AI while controlling the quality and pace of the process. And so when I think about putting Copilot into a browser, all of a sudden anybody can use Copilot, and I can use it while I'm working. It's in my workflow. So I think that's part of it, is your software integration points. But also, we just launched a solution for healthcare here at Mayo. We're really focused on the quality side and making sure that the fear doesn't become a reality. That's not an area I work with, but I'm just aware of it, that the philosophy we have is to carefully approach AI in a way that is measured and drives the outcomes we actually want from it, and not something else, some other bias. So I think accessibility and then control a little bit.
Thank you, Susan. So I'll just share some of the other questions I want to seed, and we're going to come back to them later in the day and expect them during the course of the sessions. Should I make or recommend plan or population-wide coverage decisions based on what I think would be fair for myself or my loved ones, like if I were the patient? What should the federal or state government's role be, if any, in mandating rules governing drug price transparency and or setting pharmaceutical pricing? What belief am I holding deeply about the present and future potential of the healthcare system that I would like to have my perspective changed on by someone I meet today? I want you to write that one down. Think about it and write it down. Am I, as an individual or as a company, Willing to pay higher healthcare premiums if it means a fairer healthcare system for the sickest patients? This has a lot to do with the whole rebate conversation that we're going to be having later today. What would make the work I do feel more fun, joyful, and fulfilling? Abarca Forward would be more days. What can I, as a healthcare leader, do to increase trust in my industry, with my clients and my business partners, and in the healthcare system more generally? What space do I or my organization have to experiment with bold solutions for the future that might fail the first time around, or even the second, or the third? What happens when you fail in your organizations? Thank you very much, everyone. You're going to have a great day. Turn it back to Arundhati, and you'll have a fantastic morning with AI. Thanks, everyone.